Okay, everybody, good morning. It's Dr. Rafage. Wednesday, November 27th, 2024, 7:53 a.m. Pacific time. We are going through this 2015 edition of Veterinary Surgery. And we've got a quick one today, ultrasonographic and anatomic study of the canine elbow joint. This comes out of Spain and Belgium. And in line with yesterday, we have a more interesting thumbnail, so hopefully that helps maybe attract some folks to this. The objective, number one, to assess the elbow joint using a high-frequency transducer at 18 megahertz. Number two, describe the echogenicity and echo texture of the joint. And number three, correlate the images with transparent plasinated anatomic sections. This is a descriptive study. They used German Shepherd crossbreed dogs, 10 cadavers, 5 live dogs. Results showed good correspondence of soft tissue and bone structures. Between ultrasound and anatomic sections, there was no difference between the cadaver and live dogs. Introduction. Differential diagnoses of elbow lameness of the dog include flexor enthesiopathy, non-traumatic elbow joint luxation, traumatic disorders such as jumping down syndrome, and congenital and developmental disorders like luxation, asynchronous growth, and elbow dysplasia. Elbow dysplasia has 4 lesions, primary lesions: osteochondrosis of the medial humeral condyle, ununited ancanal process, incongruity of articular surfaces, and medial coronoid disease. The latter is the main cause of thoracic lameness. Right off the bat, for vet students, that's very nice information to have. Radiographically, the presence of secondary bone changes rather than finding a primary lesion is typically the goal. With X-rays, CT and MRI, and nuclear scintigraphy have been suggested. Ultrasound evaluation of the elbow joint is common for orthopedic and ligament and neural problems in people. A comprehensive ultrasound study using a 13 megahertz transducer of the elbow joint has been reported. Materials and methods. Cadaver study. Mean weight, 24 kilograms. This was to rule out the presence of any orthopedic pathology. Medial-lateral and craniocaudal radiographs of the elbow joints were performed, as suggested by the International Elbow Working Group. Regarding the in vivo study, these dogs were healthy German Shepherd dogs, mean weight of 23 kilograms. The ultrasonographic study, 18 megahertz linear array transducer. The hair of the elbow joint was clipped. The joint was divided into 3 regions: medial, caudal, and lateral aspects, and then sagittal, dorsal, transverse, and oblique plane images were obtained. The medial aspect was delineated by the craniomedial limits of the biceps brachii and pronator teres muscles to the caudal medial limit of the ulna. The lateral aspect was delineated by the craniolateral limits of the cleidobrachial and carporadial extensor muscles to the caudolateral limit of the ulna. The caudal aspect was delineated by the medial and lateral borders of the triceps brachii muscle. Doppler color ultrasound was used to differentiate vessels from nerves. And then this table, it's not worth reading because a lot of this doesn't make sense without at least seeing images or doing this yourself. But for those who want to pause the video and read that, they describe in this table the various anatomic structures that we just mentioned and some other ones that we didn't mention and what they look like on the ultrasound. Results. All structures were visible in the 5 live dogs with the exception of 1 dog in which the ancanal process and olecranon could not be seen on the caudal aspect. There was no appreciable difference between in vitro and in vivo studies. Regarding the medial aspect, biceps brachii muscle, brachialis, and biceps brachii muscles, tendons of insertion, the medial collateral ligament, the medial coronoid process, and the median nerve were localized. So again, cool images that are not really worth probably reading to you because you really need to see them. But the dark images are the ultrasound, which they always look like that. And then the yellowish images are the cadaver cross sections. And so I don't know if you can see in this one, BA, that red dot, is the brachial artery, and next to it is a median nerve, MN, and they correlate that with the cadaver study. So A and B are the same section of dog, just A is a live dog with ultrasound, or live dogs, it's got blood flow in it. and then B is the anatomic. So pretty cool. Okay, the lateral aspect. The lateral collateral ligament and the lateral cornoid process were identified. Caudal aspect, the anchineal process and the body and insertion of the triceps brachii muscle. Discussion. Because medial cornoid disease can be very subtle radiographically, special attention was paid for secondary changes such as ulnar trochlear notch sclerosis and joint arthrosis. In our imaging protocol, the flexed position of the elbow was only used for the assessment of the caudal aspect of the joint. Moreover, an 18 megahertz high frequency transducer was not as effective in the caudal plane because of insufficient beam penetration in dogs of large size or with substantial muscle development. The olecranon ligament and the anchineal process could not be assessed in all of the joints. Hence, to identify these structures, we suggest a lower frequency transducer with a higher penetration capacity and a semi-convex surface. Moreover, this can be used as a technique for determining the prognosis of pathology, such as flexor enthesiopathy, which includes calcification of the flexor muscles and spur formation of the medial humeral epicondyle. Nerve injury is possible from trauma or orthopedic intervention, such as arthroscopy, in which the location of arthroscopic portals are close to the neurovascular structures of the joint. Ultrasonography in human medicine has been shown to be more accurate in midshaft fractures rather than fractures adjacent to joint spaces or fractures smaller than 1 millimeter. Taking this into account, we consider that osteophytes, fractures, open physes, and abnormal bone cortex would be recognized on all ultrasonographic assessment. However, as a diseased medial cornoid process can appear as fissured, non-displaced, abnormally shaped, or mineralized, we believe that ultrasound of the elbow is a more appropriate method of diagnosing soft tissue structures, similar to other reports. Advantages of ultrasound include evaluating soft tissue structures, which you can't really do that great on radiographs, lack of ionizing radiation, real-time evaluation of ligamentous movement and joint function. For example, in cases of subclinical flexor enthesiopathy, which in its early stages affects soft tissues without radiographic signs, ultrasound can be used for pathology that involves the collateral ligaments, such as elbow luxation or subluxation, which implies laxity or rupture of the lateral collateral ligament of the canine elbow joint. And that's it. That's a study. It's a quick one. So it's good to have these baseline studies to kind of compare to be used for future studies, but also for clinical cases. As usual, it's only a small number of dogs. It'd be great to have a larger number, but it also might be that, you know, if you have 5 live dogs and you basically saw everything for all of them, then that's pretty good enough. But, you know, we always want larger numbers. And the other part regarding the flexed joint positioning for ultrasound being best to assess the caudal aspect of the elbow joint, we do find the same thing is true for radiographs as well. You want to have that elbow flexed on the side view, lateral view, to see the olecranon and all those structures. All right, thanks everybody who watches in the playback. I should be back again tomorrow, November 28th, and we'll see you then. Bye.